Iowans have waited too long for this day. It has been 16 years since the legislature passed a cigarette tax. When asked, Iowans have consistently and overwhelmingly indicated they support an increase in the tax. They want to increase the cigarette tax to recover some of the millions and millions this state has spent to treat the diseases caused by smoking. They want to increase the cigarette tax to discourage people from smoking, and they want Iowans repeatedly by 71% have asked the legislature to increase this tax. I believe we should dedicate today's debate to Iowa's young people. Let's dedicate it to the toddlers who you sometimes see riding in the back of their parents' car, traveling in a haze of secondhand smoke. Let's dedicate it to the kids in our elementary schools who are just beginning to be targeted by Iowa's tobacco company ads. Let's dedicate it to Iowa's high school kids, 20% whom are already smoking. The kids who our tobacco companies hope for the future. Kids whose tobacco lobby hopes will be the next generation of addicted customers digging their own graves, one cigarette at a time. And let's dedicate today's debate to the thousands of young people who have come to this Capitol year after year asking their elected representatives and senators to do something to stand up to these special interests. Today, those young people who are going to know that this legislature and specifically this Senate are listening. Senate File 128 raises the tax on cigarettes by $1 per pack. The tax would increase from 36 cents a pack to $1.36 a pack. There are three reasons for doing this. First, raising the tax on cigarettes will improve the health of Iowans by helping smokers quit and thereby reducing the number of Iowans who each year are killed or made sick by tobacco. Tobacco Free Iowa estimates that 20,000 adult Iowans will quit smoking with this increase in the tax. Second, raising the tax on cigarettes is the best way to discourage young people from smoking. And if they don't get addicted to cigarettes when they're young, they are much less likely to start smoking as an adult. In fact, we know that as a result of this increase through Tobacco Free Iowa, that 38,600 kids will not start smoking. Third, raising the tax on cigarettes will generate revenue to support health care programs and services, revenue which will help smokers quit and help pay some of the health care costs involved in caring for smokers who are unable to quit. Iowa is currently 8th from the bottom in the states that have the lowest tobacco taxes. So we're right in there with some of the tobacco states that actually raise tobacco. South Dakota recently raised their tax $1 per pack. Minnesota just raised theirs 75% a pack. All of the money raised by this tax will go to health care. The revenue goes first to the general fund and then is transferred via standing appropriation of $127,600,000 a year to the health care trust funds. Colleagues, let's put the health of Iowans, and especially the health of young Iowans, first and get this done.